So welcome everyone to today's conversation around centering justice, a Washtenaw community conversation about COVID-19. We're really excited to engage in this conversation and really provide an opportunity to bring folks together, to do some learning together, to hear perspective from local community leaders and experts about some of their observations, perspectives of things related to the community response of COVID-19, and as well as invite others into the space to, really understand and hear from others related to what's going on. I'm really excited to announce that this is actually going to be a series of conversations that we're going to be hosting over the next couple of weeks. We do have a list of dates that's going to be shared towards the end, and we will share those dates with everyone via email following the conclusion of this conversation. So again, just to call out, if you are having any technical issues, please make note of the number that's there or the email address. We'll do our best to respond to folks. I do just want to acknowledge that we are expecting a pretty large group. There are like over 300 people RSVP'd to this. So unfortunately, we won't get a chance to do introductions for everyone, but we do invite folks to make use of the chat box that's there. If you could, share your name and then a response to the opening question that we have. But then also there will be some opportunities for folks to engage with us, and we're going to try to make the best use of the chat box feature as we can. And so let's jump in. So I'm Melvin Henley. I'll be one of the hosts or facilitators for this conversation. I'll introduce the rest of the folks who are here and assisting with putting on this webinar. All right, so let's get started. And here are some just other useful tips that we wanted to share as we move into this space, realizing that virtual connections and conversations is the new norm for a lot of folks, but also wanted to just share some tips that may be helpful. Please use the chat box to send questions, or if you need assistance. There are a team of folks kind of working behind the scenes or along with everyone in support of myself and others to make sure we deliver on this. So please use the chat box function as best as you can. If you're joining on a desktop or a Zoom app, please make sure to add your first and last name. You will be automatically muted just to keep a handle on background noise and stuff as well. So if you would like to speak a little bit later, just check that you're going to be muted. And turn on the video if possible. We would love to see your faces. And then lastly, make sure that you are on speaker view so you can see the person that's talking in addition to the PowerPoint that is being shared. And you can do that if you are on the desktop or the Zoom app. There's a list of buttons at the top there and above the video, so you can kind of make those changes.
Hey, Mel.
Yeah.
Just a quick in real-time update. We've got limitations on only 100 that can join by video. And so if others are trying to dial in, they'll need to use the phone line. And then we'll send the recording of the webinar after, okay? A couple of folks are texting me. We're at our limit of those who can be on with video at 100. Oh,
gotcha. Good to know. Good to know. And thanks for highlighting that. I think this is one of the opportunities where we're learning this experience together. And so we invite you all into this, and we'll take that in and figure out how to move forward together. So moving us along. So as I said, my name is Melvin Henley. I'm with NEW. NEW stands for Nonprofit Enterprise at Work. I'm one of the organizational development consultants that is on the team there, and I will be your host. And then the other voice that you will be hearing, well, one of the other voices that you will be hearing and just recently heard is the president and CEO, Yodit Mesfin Johnson. Yodit, you want to say anything else?
You're on mute, Yodit.
Really glad you're with us, overwhelmed by the response, and so fortunate to be able to hear from our fellows today and members of our community. Thank you for being with us.
So yeah, in addition to, as I mentioned, NEW is hosting this webinar, and at the bottom of the page, you'll just see some opportunities where you can follow along on just other events and via our social media, which is listed there. And then you can also visit our website, new.org, to sign up for a newsletter and to find out more about events and stuff that we're offering. And so just quickly, for those of you who may not know about NEW, NEW's been around for 26 plus years supporting nonprofits across Southeast Michigan. We do that through a variety of ways, those of which you can see on the left-hand side of the screen. But we provide capacity building support through IT services. We have a physical building, which we house and support nonprofits, provide meeting space and office space. And the last part of the work is the consulting arm, which I mentioned earlier. And I'd really like to say that this work that we're doing, especially with this webinar, is really in line with our mission and our vision for the organization. Over the past 26 years, we've really been committed to creating empowered leaders, flourishing nonprofits, and vibrant communities. So we really find this conversation related to centering justice and equity and connecting with nonprofits to be directly aligned with who we are and alignment with our values. And we'll talk about that a little bit later. So here is just an agenda for how we're going to spend the next hour or so. I'm kind of wrapping up the welcome. We're going to spend some time doing some context setting, having a quick scan at what's happening nationally, but then also really providing a critical eye about what's happening locally. I didn't say before, but NEW is based in Ann Arbor and also has a presence in the city of Detroit. And so what we bring to this, that we're connected to the communities that we're talking about. This is not something that we have to go far about, but these are places that we live, work, and play in at the same time, and really is meaningful for us. So we're going to have a conversation about that, and then we're going to move into a panel discussion where we're going to hear local perspectives, and then have a little bit of an audience Q&A, and then do wrap up and close. So that's how the flow of the day. Really want to just say a huge thank you to a partner in support of this work, United Way of Washtenaw County, who's helped played a role in help shaping this, but then also just showing up to really demonstrate their commitment to equity, not only before, but then also now in times of need. So while we're here, we're really here to do 5 things. One, to uplift stories from local individuals, leaders, and experts in the Washtenaw County, especially in the context of COVID-19. We realize that there's a lot of different information that's being shared, but we see this as an opportunity to bring in local voices, to not only bring them in, but uplift their stories and their experience, to build resiliency as well as solidarity for the nonprofit ecosystem, because we know that people are navigating a lot. We want to foster network connectedness. So this is why we're inviting people to share their names and organizations, et cetera, because this is a part of not facing this alone, especially as people are working from home or maybe an essential worker, that you don't feel like you have to navigate this by yourself. We want to make space for conversations that center justice and equity. And then we also want to imagine transformative solutions that's going to have an impact on these systems of inequity, and use this opportunity to reimagine the future. And then lastly, we'd just like to bring your attention to some of the norms that we have, especially we just want to invite to this virtual environment, but then also realizing that with this sort of conversation that we're seeking to have, that there may be some discomfort and then opportunity to lean in for deeper understanding. So just to read over the norms and make yourself familiar with them would be great. And then lastly, I would just like to quickly introduce the hosts, Dee and I, but then would quickly like to introduce our panelists. If you wouldn't mind just doing like a brief, 30-second introduction of who you are. Their bios weren't shared, but their names were mentioned in the event invite, as well as you'll hear a little bit more about who they are, as well who they are not as an individual, but then also professionally in their conversations. But we have Toni Kayumi, we have Hamida Bhagirathy, we've got Darryl Johnson and Clarissa Love, who will be joining us as local experts, as well as local leaders to share their observations. So Toni, would you like to do a quick introduction?
Sure. Hi, I'm Toni Kayumi, as he said, the president and CEO of the Ann Arbor YMCA. But when we also speak about intersectionality, I'm also an Asian American single mom living in rural Manchester and also working throughout Washtenaw County and southern Livingston County, serving over 27,000 individuals through our work at the YMCA.
Thank you. Welcome, Toni. We're really excited to have you here. How about Hamida?
Hi everyone, my name is Hamida Bhagirathy. My pronouns are she, her, hers. I'm a Caribbean American person, woman of color, first-gen immigrant, first-gen college student, also a divorcee, single, and sheltering in place by myself, which is interesting.
Thanks so much, Hamida. Darryl? You might have to unmute yourself there, Darryl.
I'm sorry, Darryl Johnson, Executive Director of Mentor to Youth, and married, 5 children, so 3 of them are at home, bunkering down. I'm also a essential worker, so we're still working, and yeah.
Perfect. Thank you. And then Clarissa.
I'm Clarissa Love, pronouns she, her, hers, and I also hold multiple intersectional identities, being a Black woman who is married and has a Black husband, and a mother, and also working simultaneously in teaching, but also holding, really thinking about having a disability and supporting a community during this period of time, like my other fellows have mentioned.
Sure. Thank you to you all for being here and participating. We're really excited to hear your stories and perspective. And just want to call attention to that our 4 panelists that we have joining us today is a part of our Champions for Change program, and they're a part of the Leaders of Color Fellowship. There's a link just there at the bottom of the page, but just quickly, the Champions for Change program is an ambitious program that we are currently wrapping up year 1 of, in which we're seeking to change the face of racial equity leadership in Washtenaw County. There's a few different components of the program, and there's a lot to say, so I invite you to check out the website to learn more about it, and we're really excited to have these folks involved and to hear their stories. So moving forward, I'll now turn it over to Yodi, who will take us to the next phase of the agenda.
Thanks, Mel. Also, just want to thank each of you who have joined. The grace that we asked for in our norms is active in this moment, as we realize that the number of participants exceeded the plan capacity that we have for Zoom. So we're going to fix that going forward. It includes people are not able to phone in. So we have recorded this, and I think we'll talk offline about maybe even a second follow-up session. So for those of you who are hearing from friends or colleagues that they're unable to access it, know that we're going to respond. We were moved to this work in terms of context, as Melvin said, in building on and scaffolding on our work with Champions for Change, where for nearly 2 years, we've been asking ourselves and our colleagues in our community those difficult questions about How do we pursue racial justice and racial equity? How do we explicitly name, as is the case with COVID, the existence of racism, of xenophobia, of other forms of oppression as root causes for why we see what we're seeing? And in terms of identity, I too share being both Black, single mother, one of only 21 leaders of color in Washtenaw County, a county that has more than 2,400 nonprofits, also a divorcee. I have an unseen disability, as well as great roots and ancestral lineage from the continent of Africa. One of the reasons why we're here, as you see on your screen, is to talk about and to center identity in the midst of a pandemic, to acknowledge that it is institutional, historic, and ongoing issues of lack of resources, as Dr. Benjamin Weston said, that have us where we are. And these deep structural inequities that push communities to the margin and make them more vulnerable to health crisis, even in good times, as Dorian Mason, the Director of Health Equity at the National Women's Law Center, said, these inequities in our healthcare system don't ignore race or gender. And if we're not disaggregating data, which I think we're really pleased to see happening now, at least so that we can substantiate our claims that these historic and institutional inequities are real, if we don't disaggregate that data, we run the risk of washing over what is a very real and present danger. As of last night, I sat with 20 Black leaders from our county asking data is looking backwards. We need to be looking ahead. And how is it that we begin to augment our messages and our communication strategies to save the lives of those in our community who have not been impacted? Of course, this disease, although it's compoundingly impacting people of color, is touching everybody, young, old, and otherwise. And so while we're centering the identities of people of color in this conversation, we certainly recognize and hold both love and prayer for our entire community. If we look locally, Mel, I'm sorry, this slide here just shows you that in every urban center where there's population density, where there's poverty, where there were also social determinants of health that were adversely affecting communities, that it is compounded in the face of the pandemic. And locally, right here in our very state, this data is actually increasing, but of the deaths we've had here in Michigan, 40% of those are African Americans. In Washtenaw County, those realities are the same. I really want to acknowledge Hamida Bhagirathy, our health director, who along with her team has put great data out, and her response has been phenomenal. She, like me, is less than 90 days on the job, leading through a pandemic, so we lift her. And just yesterday, I and others were featured in a Bridge magazine article intended to humanize this. I can't begin to explain to you what it feels like to know. My dear friend Marlo Stoudemire was one of the first to die in the pandemic in Detroit. And since then, I know 10 people who have perished to this disease and countless others. My timelines on social media are bombarded with Black and brown despair, death, and diagnosis. We know that people are hurting. The data is not enough. Behind that data are real stories. Let's move to the next slide. And that's really why we wanted to hear from Toni, Hamida, Darryl, and Clarissa, and all of you today. So I'll turn it back over to Mel to get us started.
Mel, I think
yeah, I was muted, sorry. So, this week marks the 1 month anniversary, or the 1 month since the first cases in Michigan were announced. And so, my oh my, how much has changed in a month, or how much of a month has it been. So we really, understand that COVID-19 is further exposing inequitable systems and practices that we need to let go of. We need to reimagine and overhaul. And so we're really pleased to be joined by this group of panelists who are going to share some of their personal stories and expertise, and then also wrap up with some of the collective demands for how we must center racial justice in our immediate and long-term response to the current, public health and economic crisis that all of us are facing. So we invite them to bring their whole selves into this conversation. We invite them to bring their intersectional identities as leaders, parents, organizers, and experts into this discussion. So with that being said, Toni, would love for you to kick us off and maybe sharing a little bit more about you and your story.
Sure. A lot of who we are is about our intersectionalities, about our past, because that makes a huge impact on how we make decisions today and the humans that we are, both in our personal lives and in our professional lives. I am the daughter of a Japanese immigrant, so I'm the first generation of my family to be born in the United States, as well as to complete high school and go on to college. I grew up in subsidized housing when I was young. English was my mother's second language, and we struggled financially. So when I look at the coronavirus crisis and the impact that it's making on marginalized individuals in particular, I come from a lens of having been a marginalized individual who lived on the edge, as many people do, paycheck to paycheck. And so I think that makes a difference in the decisions that leaders of color may make because of the empathy that we can bring to the table of knowing what it's like for those that we serve, as well as those that we employ as part of our staff teams. So one of the things that I also bring to the table is the fact that I live in rural Washtenaw County. So the Manchester area, Freedom Township, where I live, we have no grocery store. We have no pharmacy. Only 2/3 of the students in that area, 2/3 of the students do not have access to broadband internet. And so when they're talking about having your child learn virtually at home, when you live in rural Washtenaw County, where I do, and the fact that only 1/3 of the students can actually get broadband internet, that really raises that challenge of how do you as a parent make sure that your child is getting schooled at home. And I'm also an essential worker. I'm coming to work Monday through Friday every day, even in the coronavirus crisis. And so if you are a single parent with no family support with you, you're caring for your child, you're working, and you're expected to homeschool at the same time, how are we to accomplish that successfully? So trying to reach out and emphasize with any other single parents who might be essential workers as well and struggling with the technology aspect out in our community. In addition to that, when you look at who we are as individuals, being Asian American in a time period where you have blatant racism and xenophobia taking place throughout our country and in our county, it is an issue of concern. More than 100 cases of hate crimes against Asian Pacific Islanders are taking place in our country each and every day during this coronavirus crisis. They range from things like assaults on subways, verbal abuse that's taking place even here in Washtenaw County against children who are Chinese international students residing in our community, to stabbings that have taken place of 2- and 6-year-old children and their mother in Texas in a grocery store because they were Asian. And so that blatant racism that's out there is amplified when you have, frankly, a president who uses Chinese virus instead of coronavirus in language. When you have a Surgeon General who says that this pandemic is going to be similar in the crisis and the results of tragedy in our country and likens it to Pearl Harbor. When you have White House officials using jokingly Kung flu when they're talking about the coronavirus. So instead of trying to get people to understand that being Asian makes you no more likely to have coronavirus than anybody else, and that Asians are no more likely to transmit coronavirus than anyone else, This type of phrasing that's xenophobic, this type of phrasing that's anti-Asian, only adds to the hate crimes that we're seeing taking place. So one of the things that people can do as allies, if you hear misrepresentation of facts taking place, if you hear people verbally assaulting or trying to be harassing or particularly physically violent against an Asian American, that you show your support to that Asian American by correcting the fallacies that are out there and by trying to intervene and de-escalate any type of situation that may be occurring. So that's a call to action of things that anyone can do to help stand against racism. The statistics that Yodit mentioned earlier in regards to our African American population, even here in our county, where African Americans only make up 12.3% of the population, but 48% of the individuals hospitalized. We need to have rapid response in our community in regards to how can we help, particularly African Americans in our community during this time, as well as what do we do in the future to address the systemic racism that exists in regards to health inequities, socioeconomic inequities, academic inequities that are impacting the circumstance that we have right now. So it's not just an issue for now, it was an issue in the past, and it's definitely going to be an issue in the future that we have to rally around together to help correct, because systemic racism isn't something that just leaders of colors can address and solve. It must be something that everybody rallies around. So those are just some of the calls to action that I bring forward in showing what some of the inequities are in our rural Washtenaw County, as well as throughout our county as well. So there are inequities that are occurring not just for those of us who are people of color, but also Caucasians who live in rural America as well.
Sure. Thank you for sharing that, Toni. I think, yeah, I think I appreciate you, sharing those stories and your experiences, especially as being someone of Asian heritage, and, how some of the things that may have been, other people may not have been aware of, and bringing kind of that story and that conversation into this space to know that it's still going on even today, right? It's not something that as people are navigating this, that people are acting differently. So I appreciate you sharing that story. I would like to mention, if you do have any questions or comments, please drop them into the chat box. There will be an opportunity for us to, group some of the questions and share them with the presenters. So I'd like to move on now next to Hamida. And Hamida, would love to just, hear your story and maybe your thoughts or about, if you've been personally affected or how you've personally been affected by COVID-19, and maybe if there's anything that you can share in relation to people that are still out there working, people that are still trying to, bring home a paycheck because they've got childcare, or bring home a paycheck because they're trying to cover basic needs. How that has shown up for you or people you may have known? You're muted, Hamida.
Thank you for giving me this space, Melvin. So like Toni, I've straddled, and like all of us, I straddle multiple identities. I would say kind of, for me, COVID-19 has really given a lot of attention to socioeconomic status and class for me. So as a first generation immigrant, my family grew up poor, and so that was a really different experience in some ways to the experience I currently have now. I would consider myself middle class, lower middle class. I have been afforded a lot of privilege to attain an education, to have work that gives me the luxury to work remotely from home. And I think that was something I've been really keenly thinking about. Another thing I've been thinking about is sort of this tension that exists between, for at least in my experience and kind of my circles that I've been in, the tension between sort of productivity in light of working remotely from home and sort of viewing this as a positive opportunity, which it is in some ways, because I've seen my own team be really creative. But I think for me, what has risen to a lot of salience is also the thought that this is a time of grief and death and mourning and uncertainty. And in some ways, really focusing on that performance, being able to pivot and produce in ways that are similar to how we've produced before, alienates us from some of our humanity with ourselves and with each other. So my story is that I recently lost a loved one to COVID-19, and he was someone really important to my life. Got word on a Tuesday, and he was gone on a Thursday. He was also an essential worker, so he was one of the folks that did not have the luxury that I have to work remotely. And in addition to that, he was also someone of a lower socioeconomic background. And admittedly, in straddling two sort of class lives right now, my Facebook feed, you know, similar to kind of how folks have been talking about, is really bifurcated. It's stories about folks of color and folks of lower socioeconomic status who have lost folks, and folks who hold mostly privileged identities who are really sharing the ways in which they're using this time to enrich themselves. And I see like there's a real bifurcation of how folks are experiencing, you know, what truly is this collective trauma of the pandemic. I think what has been really something I've been cogitating upon is the ways in which grief shows up for folks of marginalized identity, or is allowed to show up for folks of marginalized identities, and the ways in which it's discouraged or not as, space isn't really created as much. I think a lot of that lies in our experiences. In my work team, I'm the only person who has lost a loved one to COVID-19. So I can hold the notion that this is just an experience a lot of folks within my personal and professional circles haven't had. But also it's that notion of how can I show up in a way that is true for me, knowing that my social identities as a person of color and being from a working class background, and that folks who are experiencing death, which is a real outcome of this, are disproportionately folks of a working class, lower class background and folks of color. And I think about how that shows up in emotional ways, and just, you know, what might be the tone or tenor of conversation when for some folks who are impacted differently, things are normal, we're just working from home in PJs, and what the tone feels like for folks who are really deeply impacted, what space that has. I also think about how that shows up in codified ways of how grief is sort of allowed within structures and systems. So I think about, how is leave time classified? Who gets to have leave? What is that? What is a valid reason to have leave? You know, as I've been connecting with folks and chatting with folks, there's certain, as someone who's a divorcee, I have no children, I'm okay with that. I think about how lots of leave policies center around taking care of children or taking care of family members. And within that policy, as well as leave policies for loss and death, because for a lot of us, loss and death is a real part of this. And what is most striking is that the embodied ways that we are typically accustomed to acknowledging, celebrating death, having a funeral, having a ceremony, that's really different. We're deferring grief for 3 months. But I think about the ways in which death may or may not be acknowledged as a valid time for taking time off or being away for different folks in different circles. I think about how family is classified. So a little background about me: my mom was Muslim, my dad was Hindu, and you probably have surmised that they didn't get along because of religious conflict. So for me, my family doesn't look like the traditional government declared family, but you know, my ask is to think about, how is grief codified or allowed in your organizations? Do you have criteria for what family counts as? Is it children, spouses, grandparents, and parents? What does that mean? What what litmus test or proof are you asking for folks to really qualify that their grief matters or their need for space matters? What does time off really mean? Like, what space and grace are people given? How does that show up disparately for folks of different identities? So as we're together today, I really want to join folks to think about how we collectively view this as a community problem. And while my grief and hurt is mine, it is also ours. And I think we have a collective responsibility to support each other.
Thank you, Hamida. That pause was intentional. You know, just really allowing the stories and perspectives that are being shared to sit with us. And you know, as we said before, to lean into this discomfort. You know, some people have been able to pick and choose, you know, their news outlets or how they're pick and choose, you know, what they surround them by. But when you're confronted with it, I think it has a different effect on you. So thank you for sharing your story and your experience with us. And thank you, Toni, for also sharing, you know, your experiences, your experiences as well. Before we move over to Darryl, I just want to check in with Yodit to see what's coming up in the chat box and if there's any questions or comments.
Bear with me, I'm multitasking. Can you hear me?
Yeah.
Okay, so just want to mention that we have 35 folks watching live from Facebook, which I'm simultaneously broadcasting you all for those who weren't able to join. In terms of comments and what we're seeing, I think there was a lot of support for Hamida and appreciation for her vulnerability. And give me a second here. Just moving through. So yeah, lots of condolences and even someone with us who's an end-of-life doula and holding, talks about the importance of holding grief right now. What are the ways and practices to not defer grief for 3 months? Someone offered for us to think about. The bifurcation piece that Hamida offered was super powerful, and Hamida, just know that there is a tremendous amount of outpouring from this online community of support to you, including my own.
Thank you, Yodit. Yeah.
Let's move on to our next speaker. It'd be great to hear from them.
So just to bring, I think I saw in the chat where there was kind of questions about people who are working, you know, in education or people who are connected to like students and whatever the case may be. So I think, you know, I would love to hear from Darryl Johnson, who is doing work directly with students and parents, but then it's also doing work that falls into the essential category as well. So Darryl, would love to hear just how you're navigating this space and time.
Thank you guys so much. Appreciate the space. Hamida, we love you. Toni, thank you for your sharing. I, as Executive Director of Mentor to Youth, really have taken a little bit of for not responding, right, and not saying a lot, but I've kind of felt like things were being said over and over and over again. And I think from my perspective, I'm really concerned that, you know, why when America catches a cold, Black folks catch the flu, right? And over again, we are always just kind of accepting more of the brunt of anything that comes through this country. And when I look at most of the solutions that are offered, they're always at this top level, and they never really get down to the bottom of the funnel. Solutions are delivered, they aren't really nurtured and empowered from the ground up. I think the information and the contacts that we need to have has never built, we never take the time to build the way we could have the relationships and the communities that we can really talk and get a message out to people that need it the most and are mostly affected by it. I know for me, you know, like you said, this came up on Michigan, and I, you know, kind of half-heartedly took it seriously. And then my wife's first cousin, the Detroit police captain, Jonathan Parnell, died, you know, without any notice. And it really impacted our family. It made us get serious about it. I was watching a video by Magic Johnson and talking about how it reminded him of the AIDS epidemic 30 years ago, how maybe Black folks didn't think we could get it, right? And the same thing with the COVID-19. We're out there thinking that maybe this isn't about us. And so that communication and direction needs to be driven down so that people can get this message. But we won't build that infrastructure. We keep waiting for the emergencies to happen and then say, oh, the infrastructure is not there, when we had opportunities to build it. I think our biggest problem is not really looking at creating solutions that are grassroots and push up. Where are the parents allowed to have these? I've been in a lot of great conversations. I've been on a lot of great Zoom meetings with a lot of powerful people. And I know that I am privileged to be in these spaces and have these conversations, but I always walk away thinking, what about the storekeeper or the person on welfare or the person down and out that's barely making it? How do they get this message? How do they get privy to this kind of information as to what to do and where to go? And I think it's imperative that as we look, what do we do about COVID-19, but also what do we do about the systems that created the inequity in the first place, right? We're struggling and fighting through this because we didn't answer some of those questions beforehand. I apologize, I kind of do my best talking when I get angry, and I'm just warming up. So, you know, when I look at COVID-19 and I think about the bottom of the funnel and not reaching deeply into our community, I was on that call with Yo Deep yesterday with some community members, and I'm really blown away how the messaging is different for us and how you can't send in a package of Band-Aids to our community and expect healing to take place. That healing has to come up from the bottom with people that are trusted guides within the community that can spread and have their voices really be recognized and understood. So one of the things that I really thought about, and it really challenges me, and I don't know if other people think of it like that, but I think about it, what if I don't make it through COVID-19, right? What if I'm one of the ones that get caught up and my family has to pay this ultimate price? I sure hope that I don't die in vain, that this system is allowed to continue in the same way before COVID-19. Our position at Mentor to Youth is that we need to drive down communications and these conversations in a social setting that produces something for Black people, where Black people have a chance to be vulnerable and open and ask the questions and have some back and forth dialogue. So that's what we're continually working on over at Mentor to Youth, how to build that, how to create that, how to make that across the county. Superman's not coming.
And Darryl, if you had, you know, someone in front of you, like as a group of folks here today, like what would be an ask or demand that you would, you know, place in front of them or challenge or?
Well, it's really about supporting the community building efforts. I think it's kind of amazing. I think it's amazing how people don't see that community is the solution, right? Community where we come together and really listen to each other and talk to each other, not trying to change each other or make somebody into something, but allowing people to just be them full selves. And so one of our first event, we were just getting ready to have an event out in the school where we talked about bringing parents in and just being able to have that dialogue. So when we come back from COVID-19, that is going to be our mission, is to have these micro communities. I think every school is a community within itself. And what we need is we need a little bit, I'm telling you, the cost of supporting this solution is a lot less than the price we're paying right now because we didn't have this information structure. And so when I see somebody, I'm like, support us in building this so that we can talk to those at the bottom of the funnel and not just have these conversations at the top. Thanks for that question.
Darryl, if I can add, one of the things that you mentioned last night on the call that I thought was really powerful is that you're trying to develop a system to text families because the social, folks that don't have internet access or can't jump online or don't have cable may not be getting important messages to protect themselves and their families. And what I heard you say last night is Mentor to Youth is trying to establish a network through text messaging. This is a practical thing we can do now to text folks to say, hey, if you're an essential worker, here's where you can get a mask, here's where you can get gloves. If you need food, here's how we can get it to you so you don't need to come out. That was really enlightening to me, how text messaging in our communication strategies is really essential.
Yeah, and we've already got it up and running, but to kind of expand it and to really be able to utilize the spaces where we're already coming in contact with people to build that network so that we can have that instant communication. And like you said, people who aren't, who don't have Zoom, who don't have a cable television. I took that for granted. I thought at Mentor to Youth, we would just switch over, right, and just go virtual. And then the realization that our kids don't have internet, right? And so being able to touch that, I think, is a structure we would love people to come in and support and help us build that all down.
Speaking of that, sorry, Mel, I just wanted to add one of the impetus for this series on centering justice was a conversation I had with Alina Zachary Ross, the superintendent of Ypsi Community Schools. And when they surveyed their families, 80% of them needed technological support in order to be able to have their children do virtual learning. And we're still trying to get those resources to the east side of the county. So while many of us presume children can just begin virtual learning at home, there are all kinds of dynamics and layers, including just the fundamentals of technology access, not to mention what Toni mentioned, the balancing of trying to educate multiple children at home if you're a working mom, et cetera. So thank you, but just wanted to mention your comments about access to technology, access to learning opportunities is very real.
Thank you.
And thank you for sharing that story. And then adding the further context there. There was questions, I just want to acknowledge that someone asked about how they would be able to get in contact with the panelists. We will, if you have stuff that's top of mind, you can send us an email at info@new.org, and then we'll make sure that it gets to the respective folks. And so we can go with that. And then in the follow-up communication, we'll just outline a further process or direct you to a website or something if you need to get in further communication with folks. And so the last person that we have, last but certainly not least, Clarissa, would love to just hear about your experience kind of being in the community and hearing, what you have observed and how people the different bodies, the beautiful bodies and experiences we have been navigating, this space. So Clarissa, if you could share a little bit about that.
Yeah, thank you so much, Melvin. I think you hit on a point earlier. Can you hear me?
Yeah.
Okay. Yodi hit on a really good point earlier about the ability for us to be able to look forward. And I think it's also important for us to be able to look backwards, even further than just in COVID. And so for me, as I was sitting here, I like prepared like bullet points of what I was gonna share, but as I was sitting here and I was staring at my name, it just totally changed for me. And my name is Clarissa Love, which you can see. And the Clarissa comes from my grandmother. Her name is Clara. And she died before the age of 50. My middle name is Nelia. That is also the name of my other grandmother, who died before the age of 40. And so if you think about that loss in our family, it's not palpable what growing up without grandmothers has meant. Therefore, as Hamida shared, that has meant the restructuring and the creation of a new family for our family. And that has centered on adopting and building community and family in ways that I would have never thought. And so I enter this work from a lens of health disparities and thinking about how do we really identify and share and think about the health outcomes. And we have well documented it within Washtenaw County, the differences of zip code and what your life expectancy means. And so as COVID was ramping up, I will be honest that my anxiousness and anger was wrapping up because I knew there were going to be different outcomes. Before the data was ever released, before we ever saw it within our community, I knew because I could see from what we had seen in the past over time. And so really James Baldwin's words really resonated with me. So I'm going to put them in the chat and then offer how I think what we can really do in response. And this comes from two places. And I think there's two strong emotions for me, which is love and anger. And I think that sometimes we don't allow for two emotions to coexist, just as we don't allow for multiple identities to coexist. So for me, the love comes from the ability for me to see community and for me to want all of us to see this as our challenge, our issue. This is not my issue. This isn't Toni's issue. Hamida's, Darryl's. This is everyone, right? Like whether you're a person of color or not. And so out of love, I want you to join me in this journey. But out of anger, I want you to see the hurt and the harm that is happening within my own family. When I talk about those losses of my grandmother, when I think about the losses as I scroll my timeline, I'm also a person that has both a visible and an invisible disability. So I was born with spina bifida, which is a congenital spinal disorder. It has meant that I have been in and out of the hospital my whole life and have navigated having a physical disability. I also have an invisible disability. I struggle with anxiety pretty bad. And I've had to do a lot of work in reframing, and I feel that I am at a fabulous place with my anxiety, but it is a real thing. And so when I see COVID happening and I see the anxiousness in our world, and I see the dismissal of depression and anxiety in work environments, it is concerning to me. So I hold all of these identities together. And what I will tell you is that the intersectionality, Kimberly Crenshaw first, showed that work. And that the intersection of our identities compound, right? So when I scroll my timeline, I not only see Black folks talking about what's happening in their families and in our own homes of us having such grief and loss during this period of time, but then I also see in my disability community talk about eugenics and how people are debating the worthiness of life during the COVID-19 response. And so thinking about how folks are living with compounded identities is really important in the intersection of those identities. And then the point I made about love and anger is that allowing for folks to come to this work from different places is important. And I think oftentimes when we go into communities of color and we want to serve underserved folks, often there's a strong frustration there because they're like, I have been here the whole time telling you that I don't have access to healthcare, I don't have access to internet, and now it has become an emergency. I have been living this every single day of my life. And so having the respect of when you go, that anger isn't at you, but that anger is at a system that has created oppression. And so we are in a place where folks don't want hope, they just want to see change. They have seen and heard hope a long time, and I know that, I want to keep it brief. My last thought is, as you interact and think about your frontline staff, think about the intersection of their identities, even those that are working from home. As you're developing policies, how are you going to be thinking about folks from a place of different groups are going to not just be thinking about flourishing and having mental health while working from their computer, or thinking about if they can get their $600 wagon, as I saw in one Facebook group this week. You know, they're thinking about survival, and so there's a lot of fear there. And so how can you dispel and reduce fear for your workforce by communicating in real time with as much honest information as you have? And also, how can you make sure that as you're designing policy, you bring together the intersectionality that we're even seeing in our panel today to help with the designing and thought process? I think there's so much wisdom within group, and so allowing for community to happen is powerful.
Thank you.
Clarissa, will you read the quotes that you offered in the chat box, please, for those who are listening on the phone?
Oh, absolutely. Thank you. Sorry about that. The quotes that I offered are, if I love you, I have to make you conscious of the things you don't see, right? It is my responsibility to share with you my perspective and my experience so that you are allowed to see things differently. And the other quote is, to be a Negro in this country and to be relatively conscious is to be at rage almost all of the time. And so there's often this dynamic of people talking about anger within communities of color. And I just wanted to paint that those things both live at the same time, this love and this anger from what we're seeing. The data is heartbreaking, right? And it's not happening to someone else, it's happening to me. As Darryl said, I am in a vulnerable population. This isn't me talking about some statistics of way off people.
Thanks, Clarissa. All right, Mel, you ready?
Yeah, it's on. It's on you.
Okay, I'm not seeing the screen, your screen sharing at the moment, and I don't know if that's, oh, there we go, I got it, thank you. Can we move to the next slide? Yeah. So this is, and I could use your help with the time check. I've got like so many devices open.
It's 1 o'clock now.
Okay, awesome. So my task here is to ask that folks who want to engage with our speakers or have questions, and I see some of that happening in the chat box. And also sort of this deeper question that came up from Mel and I as we were working, and I think working on the series. And I think it's a question that Darryl posed as well, which is, you know, what are we learning now that is going to transform us? I worry a little bit that we've been so shaken emotionally and stretched in so many ways that we're craving a sense of normalcy, like to go back to what was normal to us, and yet that's so consequential. And so I've been asking, and I'd offer to you all, first, any questions or ongoing dialogue you want to have with the facilitators, and second, what are we learning, realizing that this is dynamic and happening in real time, that's going to transform us as individuals, as organizations, and as a community, so that we don't return to the status quo. Clarissa, while we're waiting, people are just thanking you for sharing your thoughts. They're thanking all of you. Laron notes that COVID-19 has placed a spotlight upon the inequities and of our society and of most in the world. The ways for us to continue in the aftermath will have to be on a scale that compares to the ways humanity has been able to move past mass-scale historical evils. It's not a short-term, small-scale disaster like a hurricane. It's a worldwide phenomenon that calls for a massive restructuring of our values and our way of thinking. And he offers that at the core, it is the issue of placing human life above the products that are produced by humans.
Yeah, I want to add one thing. We've really been talking today. A lot of us have shared, and I know we have, between the fellows, we have international experience. And I just want to share that this translates the U.S. construct. These disparities live and exist within the U.S., but we're seeing an impact globally to what resources communities around the world are getting access to and the prioritization of life. And so I just want to acknowledge that. I just felt after that quote, it just really resonated with me.
And Yodi, you had asked the question, what have we learned during this crisis that we can bring forward with us? And I think the idea of being able, for those who do have internet access and technology access, that we can engage virtually. A lot of what the YMCA does is, face-to-face, in person. We're feeding kids right now and adults who are in need of food assistance by collaborating with community partners. We're doing childcare for individuals who are considered essential workers, like those that work in senior living communities, hospitals, first responders. But one of the things that we're about to ramp up for free for anyone in the community, because so many people are isolated in their homes right now. And it's very evident that physical health and mental health go hand in hand sometimes, and that physical activity can improve someone's mental health. Yet we're being told, don't go outside too much, don't congregate too much, but we still need to get some exercise. So anyone in our community who does have technology access right now and wants to, on April 15th at 8 a.m., whether you're a member of the Y or not, we will open up registration to the community at large for free online classes of a variety of different things from different levels of ability, whether it's sit in your chair and do some yoga for those that have less mobility, to HIIT classes that you can do from home using very simple things that you will find around your house. We just want to make sure that everybody, even if they can't get into a facility right now, or they're being discouraged from going out and about because they might expose themselves to others, that there'll be this opportunity for people to get some exercise, be part of a community like we're doing right now online, and also hopefully improve their physical health and mental health during the crisis.
Toni, thanks for your leadership there. I want to just do a quick chat again. People are asking if for a link that could be shared. So if you could put
very
that
simple. Just go online to AnnArborYMCA.org on April 15th at 8 a.m. and sign up. As you found out from today's experience on Zoom, we'll be limited to 100 people per exercise class that we're having or other type of thing that's online and available. But there'll be various classes at various times on different days, so feel free to register for them, and we're going to be doing that through the length of the coronavirus crisis. And then there's also online at AnnArborYMCA.org for your kids if they're getting a little stir crazy, and you, the parent, are getting a little stir crazy, fun science projects, crafts that you can do, many other things. And this is for kids who are preschool age. So I know a lot of the schools for kids who are actually K through 12 are providing online resources. But if you have a little one, like toddler aged, this is crafts and activities and story times for them.
Thanks, Toni.
All free.
So we'll get those resources out. We also want to remind folks about the census and how important it is that we take the census, which you can do online. The census, each of us that responds are helping to bring those necessary federal, state, and local dollars into community. Each of us represents about $1,800 a year that goes into many of the programs you all have referenced. So please take the census. Mel, can you get to the next slide as we begin to round out? I'm just checking the chat box quickly. Lots of our community leaders encouraging census engagement, and thanking you, Toni, for the amazing work you're doing. Listen, in terms of demands and calls to action, what we heard from our fellows are, words matter. every one of us is essential. And so we want to be moving with that value system that we all matter. When we talk about anti-Asian sentiment and racism, have the courage to act now. When we talk about targeted communication to communities of color, as Darryl did, we're talking about developing communication that has displays images that look like people of color and messages that you can co-create with the community that appeal and that they identify with. We do need to make sure that our essential workers are protected with masks and gloves, so let's think about that. Obviously, we don't want to use the N95 masks that need to get and the other PPEs that need to get to healthcare folks. Clarissa reminded us to engage people as you're building policy and procedures, specifically around grief as we think about folks coming back. You know, be an anti-racist. There's also lots of sentiment, you know, Darryl referred to these sort of myths that were perpetuated early on, that Black folks couldn't be infected by this disease. We have to push back on that. It's just not true. And then this larger existential question that we all need to sit with and we're not going to answer today. But why did it take this, you all, for us to respond in this way, for us to get necessary food to families, for us to create mutual aid, or at least to illuminate the importance of mutual aid, for us to, you know, I'll take responsibility at new, like for us to figure out how to go virtual and to be able to engage with 300 people. We've got to really think about what our reintegration will look like. So those are some of our asks, and we'll send you this deck too. Can you go to the next slide, Mel? We're gonna keep digging into this series. One in the future is focused exclusively on anti-Asian xenophobia, and I'm working on that. We also want to talk with Hamida Bhagirathy, the head of the health department here, and understand more how we keep folks together. We need to talk about the impacts of mass incarceration and other vulnerable citizens. We want to talk about Black and other people of color mental health. So we're excited to welcome Michelle Rodriguez, who will lead one of our sessions. So we'll get the titles up. Please hold these dates and join us. I also want to acknowledge that this is a holy week for many believers in our community, both the Jewish faith and the Christian faith. And we do realize today is Good Friday. We meant no disrespect, but the urgency today as we think about peace, as we think about our faith, as we think about believing, we felt that we could hold both the power of Good Friday and what that means for Christian brothers and sisters and the urgency of now. So we appreciate those of you who had grace for us while we took advantage of this session today. Ananya is going to drop a survey in. We really want to hear your feedback. Please take a moment before you transition to the next thing to help us understand. We know we need to upgrade just for you to the next level of Zoom so that we can have all of you with us. And thank you for your grace. We're so sorry that so many weren't able to join. But I want to thank Ananya, Melvin, our panelists for doing everything they possibly could, and for all of you for participating. Please complete the survey. Mel, you want to wrap us up?
Sorry. Yeah. Ooh. Can you hear me now? Sorry. So yeah, so really just to echo a thank you to all of the panelists today. You know, we really appreciate you all sharing your perspective, inviting folks into to the world and space that you're living in, the vulnerabilities that were offered. And I think as was mentioned, that we really wanted to uplift the experiences of the various parts of our community. So the Asian American, Pacific Islander, you know, Black and Indigenous and other people of colors, as well as their intersectional identities. And we welcome and encourage those into the space as we move into solidarity with these communities who are leading organizations or donating to organizations or serving these communities. All of them are welcome into this conversation. And that will be a theme that carries on until the next sessions, as Yodeep mentioned. We really, sorry for those who weren't able to participate. We'll try to get that figure it out moving forward. If there's any thoughts for folks who you think should reach out or would serve as great panelists, please reach out to us. Our contact information is on the page there. We really appreciate you all showing up. Huge amount of gratitude to our partners and supporters at United Way for assisting in getting this done. And then the two things that we just want to close with is that we do have a resource and links link that would, a number of the articles that we referenced are mentioned in there, as well as other opportunities, whether it's from United Way and BT and other folks that we would love for you all to encourage. We would love for you all to explore and click and share with others. And then lastly, just want to leave you with this image that really resonated with us, where imagine a world where we all count. So thank you all again to everyone that showed up today. We'll be back in 2 weeks to have another conversation in the Centering Justice series. Again, if you could take the time to fill out the evaluation form, that would be hugely appreciative. Thanks again to the panelists and to the folks behind the scenes. And we look forward to connecting next time. Be well, practice mental health, check in on others that are around you in your community. Thank you all so much. Bye. Bye.
Have a good weekend, everyone.
Thank you.